Hello and welcome to Vibrant Living Diaries, the podcast where we unlock the secrets of how you can renew your inner vitality and relearn what it means to live a life with energy and purpose. I'm your host, Danielle Grodman, and I'm proudly here with the International Wellness Alliance. This alliance is home to experts across the world whose specialties allow us to cover the entire spectrum of health and wellness, and bring that knowledge to you right here on this platform. Just as a disclaimer, the stances our guests take on this podcast and the topics we cover are not representative of our individual perspectives. If you're planning on making any lifestyle and/or health changes based on what we cover here, please consult your main medical wellness practitioner to find the best next steps for you to take on your wellness journey. Today we have a special guest with us, Dr. Angela Rahm, a naturopathic doctor who began her practice in the field when her 11-year-old son fell ill with a disease that no one could correctly identify. Despite no one believing her, Angela's intuition regarding her son's condition proved to correctly diagnose her son with Lyme disease, and thus pushed her into the world of naturopathic medicine, where she today is empowering others to take on their own health journeys. Today's conversation will be centered around the necessity of understanding our blood, the stimulants of ill health in the body, and why Angela's perspective, when it comes to her approach to care, doesn't involve loads of supplements, shots, and medications, and why she encourages others to follow in the same path. So without further ado, Angela, thank you for being here.
Well, thanks for having me.
The last time we spoke, you mentioned that your start into this whole field was because you basically had to become an advocate for your son in terms of basically saying, hey, he has Lyme disease and no one believing you. How did that skepticism that the doctors had to you and how you had to really be the advocate for your son shape how you now approach patients and their care today?
Yeah, we're talking over 17 years ago, and I was a mom. I was a business owner. I owned a couple of restaurants. I didn't know anything about any of this stuff. I worked a little bit, I dabbled in essential oils. And when my son literally was debilitated and no one could give me answers, I think what most people who get into this field, it's because either themselves or someone they love is suffering so bad and they're not getting any answers that they have to take a step back and go, okay, time out. Like, what is going on? And you have to become an advocate for yourself or for that loved one, and especially a 11-year-old boy, right? So I was really shocked at how the medical field kind of ignored my concerns, my thoughts, my suggestions. And it kind of just goes to tell you, if they don't see something and there's not usually a prescription or some sort of therapy or surgery to attach to whatever that is, their hands go up in the air and they're like, I don't know. And that's kind of what happened with my son. And after going to several doctors, we finally met a doctor. He was just a normal just a normal doctor at a clinic. And he was near retiring. And we literally were walking out of the building. And he came back and he said, hey, something inside me says, I need to listen to you and let's run a Lyme panel. And he did. And he called me a little kind of on the shock side saying, oh my gosh, your son tested positive for Lyme's disease. And I was like, I told you. And I was like, but now what? And since he had been suffering it for a while, they did put him on a prescription, the common one, doxycycline. And it helped a little, but 5 years later, it kind of came back. This doctor had long since retired, and then I was really my only source to go through was naturopathic medicine. So I sought out doctors and learned a lot. I asked a lot of questions, and I became very kind of passionate about reading labs and finding out like what is going on and what supports the body, because it's not necessarily the diagnosis, it's what you do about it. Like, there's not that many things that cause the body to go ill well. So if we start focusing on some of the basic things, we can really start to heal the body and let the body handle what comes at it. And that was, now I just operate on trying to get to the root source of what's going on. And I look at blood work. It's not the only thing I look at, but we have to take their symptoms into consideration too, because if we don't take care of the symptoms, it doesn't matter what the diagnosis is or what the labs say. They want to feel better. And I always want to kind of take their symptoms and what is important to them and combine it with what the labs tell me and then complete a program for them.
That's beautiful. When you're speaking about the blood and like the importance of it, along with everything else that you do take into consideration, how does understanding your blood help you in terms of understanding what medications you should or shouldn't be on? Because there's a lot of people that are under the impression that, okay, if I'm feeling lethargic, then I can take a supplement for that. If I feel like, oh, I may be not getting enough like vitamin D, then I can take a supplement for that. So how can actually looking at those blood labs and actually like understanding what those different like values and variables all mean, how does that help us with the medications and the prescriptions and the supplements that we're taking?
Well, obviously, as a naturopathic doctor, I don't work with prescriptions, but the first thing is if you are on a prescription, you need to go in and you can even do a doctor Google. You can call the company, you can call a pharmacist. You need to make sure the medications you're on aren't actually causing the symptoms that you're experiencing because one symptom, you could be on one medication for one symptom that could be causing another symptom, but then you're like, well, what is that drug now? So it can be a vicious cycle. And by taking a quick look at what the side effects are for the medications somebody is on is, I mean, a lot of times all we need to look at. And then it goes back into looking at the body and seeing, okay, it's putting the pieces together. And I would say there's not really one method to follow of priority because you have to take in consideration their symptoms. But when we look at blood work, the first thing I am looking for is infection in the CBC with differential. You always want to get that done with a differential. I don't know why they would run it without it, but they do, and they do it a lot. But with differential, because you can actually see what white blood cells are spiking up and fighting. And you can also see the ones that are suppressed. So maybe there's co-infections involved. And so if you're dealing with infection, the body really doesn't care what else you're trying to do. You want to lose weight, you want to, have better brain focus. Body is worried about fighting this infection right now. The other thing is one of the best things you can do for your immune system is vitamin D. So substantial, high dosing of vitamin D. I would only do that if you are working with a practitioner and you understand the lab ranges and what might be going on, because we can see, with calcium levels, we need to be sure are okay. We need to look at thyroid. Like we can see a lot of health concerns within the blood work, but there's really no definitive way to say X, Y, and Z are the only things to look at to treat with XYZ supplements. So it has to be really, you have to dive into it. And it is a puzzle. There's no doubt about it. It is definitely putting the puzzle pieces together. But the top things that I am first looking at is when I look at somebody's lab, I open it up and I'm like, infection, yes or no? What's their vitamin D level? What's their white blood cell count? What is their cholesterol? Are they suffering with so-called hormonal issues? I want to know their cholesterol because if their cholesterol is tanked, their DHA may be tanked, their testosterone, their estrogen, progesterone, all of that can be definitely affected. And then blood sugar is a big deal, like things that go along with blood sugar. We want to make sure, is weight an issue? Is brain function an issue? Is there neuropathy type things going on? And the thyroid panel is one of the most controversial labs because so many clinics and doctors ignore a full thyroid panel. They want to run a standard TSH, and that is such a minute piece of a thyroid panel. It actually can tell us a lot about the pituitary more so than the thyroid. But that's a really critical lab. And then one of the other big ones is an iron panel with a TIBC, the total iron binding capacity. So all of those things need to be looked at. And then what are the red flags? And then how are they pieced together? And I do teach on that. And I've done videos on it. I've actually done it for, this organization, for the Wellness Alliance. And there's a lot to it. But once you get the basics down, it's amazing. Like you'll never let a doctor tell you everything's fine again. Like you'll be able to know more than your doctor is what I like to say to people.
It's always a fun feeling of knowing for certain what is going on in your body just from understanding the facts. So, kind of going off of the facts, you touched on a lot of different components that has to do with blood work. the 5 white blood cells, there's the eosinophils, the neutrophils, the basophils, and the T and the B cells, if I'm not mistaken. When you're looking at a blood panel, what do each of those indicate, and how does that change the trajectory of the care that you give that patient? Because if I'm a patient and I'm coming in and maybe my neutrophils are high but my T and B cells are low or whatever, something like that, then I may not know what that means, and I don't know how that's affecting me. All I know is that I don't feel right and I don't feel well.
So when you look at this is in the CBC with differential. So this is a very important lab, and it is so critical to have it ran with differential. And the components of it that we look for: infection, the immune, are going to be, well, we want to see the white blood cell count. We want them between 5 and 8. If they're at the tail ends of either of those ranges, we know the body is fighting something. So then we go down the panel and we start looking at the 5 white blood cells. So on the lab work, what you're going to see is neutrophils, and neutrophils fight bacterial infections. They usually come with co-infections. It could be a fungal, it could be parasitic. They usually have a co-infection, which you don't necessarily, you might not see that on the actual lab, but you will see neutrophils. Like I just had a lab come through today, and his neutrophils were 79. Now it's out of 100. So you've got all 5 of those that are actually out of 100. So a 79 for neutrophils tells me his body is absolutely fighting a bacterial infection, and probably a fungal infection too, because you don't see fungal on a lab, but you can presume that it goes with it. It's just a co-infection that often exists within bacterial infections. The amazing things is, if you're working with a practitioner, they will have access to some great supplements. Many of these supplements you're not going to want to just buy online or Walgreens or CVS or your whatever store. You're going to want to walk with a practitioner, work with one, because there are ways to do this and to do it right, so that you don't become more sick or have any kind of adverse side effects. I mean, you'll have to work with this, so they're going to fight. That's what these bacterias do. They fight, and they're going to fight hard to stay alive. And so we need to gently work on getting that taken back down and hopefully eliminated, the infection, what's causing some ill health. So neutrophils are going to fight bacteria, and we don't want to see them. And we're talking US basic ranges. We don't want to see neutrophils over 60. So a 79 out of 100, the immune system's upregulated and fighting that for sure. It's fighting bacterial. Lymphocytes are going to be the next one, in abundance wise. And we don't want to see lymphocytes generally over 30. We used to say 40, but what we found, if we catch a low grade infection just over 30, we're going to get this person through the kind of the hard part of not feeling well a lot easier, and without, just feeling like they've just been hit by a freight train. So lymphocytes over 30 are going to be fighting viral. And so you don't want to just necessarily go to the doctor and get prescribed something. And chances are, if they're 30, a doctor is not even going to give you anything. They're going to be like, no, just go home, sleep, rest, whatever, and take care of yourself. And to some degree, that is basically what you can do. But if it gets even higher, we get into the 39, we get 40 or 50, we start getting high up, that the body is definitely under attack with a viral infection. And again, it could have a co-infection of fungal or parasitic. So the other viral is monocytes. Monocytes you'll see on your labs, and the ranges are generally 0 to 7. And in functional lab ranges, which I'm speaking in functional lab ranges, not lab ranges, and I'll touch on that here in a moment to know the difference. Monocytes still fight viral, and we want to, as we get at 8, 9, 10, we're thinking, okay, you might be having an outbreak of a herpes simplex. There could be signs of maybe some mono. Maybe as a kid you had mono. Maybe you don't even know you had mono, but as a kid you maybe were home you just remember being home for like a whole month straight, and you just were exhausted, but you were never diagnosed. You could have a mono outbreak again. You could be having a flare. The other thing that monocytes will look at is Epstein-Barr virus. And Epstein-Barr virus usually likes to lodge in the thyroid region. So we can look at monocytes and compare it to maybe what's going on with the thyroid panel and start supporting the thyroid panel and supporting a viral infection as well. And with bacterial, viral, fungal, and parasitic, there is absolutely supplements that can take care of this. If you're working with a qualified health professional, they know what they are. There's not many, but there's too many to talk about right now. And since we're global, not everyone would have access to it. But definitely, if you're working with a naturopathic doctor or maybe even an herbalist, they are going to have solutions for you. Then there's the eosinophils and basophils. Basophils I don't generally talk about because I don't think out of probably thousands of labs that I've looked at, I don't know if I've really ever seen them out of range unless eosinophils are skyrocketed. And it's usually eosinophils are going to be linked to either food sensitivities and or a parasitic outbreak. And I have been shocked with some of the eosinophils, and I treat it as a parasitic infection, and we just knock it out of the park. And within a week, people are feeling better. So we want to look at these five, mainly four, because basophils. If you saw something out of range, I would be a little shocked. We really don't see them out of range very often. But the other four, your neutrophils, bacteria, your lymphocytes, viral, your monocytes, which is a form of viral specific to the kind of the mono and herpes simplex and Epstein-Barr virus. And then, of course, the eosinophils, parasitic food sensitivities. Those are going to be the first things you want to look at. Dive into those numbers and see where are they at? Are they out of range? And if they're just a little out of range, you might even be coming out of something. Because here's what we know. Most people will go get labs, not when they first feel sick. They've been home for 2 days. They've called their doctor. They can't get in right away, or they're just too exhausted. And by the time they get to the doctor, get labs done, they might be coming out of whatever is going on. And so we have to look at labs also as a moment in time. Now, I did mention lab ranges, right? How do lab ranges vary between, say, a functional lab range and a conventional lab range? What most people don't know, and this was shocking to me when I first heard that, I was like, oh my gosh. And I can only imagine in certain parts of the country or in certain parts of the world how this could even be so much more detrimental to our health is lab ranges are actually it's on a bell curve, and the bell curve is based off of who is coming into that lab or that clinic where they're running the labs and getting lab work. Well, who gets labs? Sick people, right? They're drug testing, annual checkup, and they're continuously not feeling great. And the lab ranges are very skewed towards the sick. So if you're generally a healthy person and all of a sudden you just don't feel great and you go to the doctor, you're going to come out, the doctors are definitely going to be like, everything looks good, blood sugar might be a little off, or your cholesterol might be a little high. We want to understand what the lab ranges mean, what the actual labs are telling you about your body, and then make decisions. Don't make rash decisions until you've done a little research before you consume that medication, because it could actually cause, believe it or not, you could be taking a medication for certain symptoms that actually cause the very symptoms you're experiencing. So you want to do your own due diligence on the medications.
Yeah. Oh my goodness. So, with all this in mind, you told me on our last call that there are three, I want to say, factors that cause ill health. And we didn't actually dive deep into those. But from what we've talked about already, I feel like there's like five or six. So how do you condense it all down to three?
Well, like I said, there's three things that we know have to be foundational. So we want to make sure our diet is healthy. We're eating clean food. Now, this doesn't mean a vegetarian diet, and this gets, again, there'll be people who will be like, what? Vegetarian supposed to be the healthiest diet. Not for everybody. And I think the number one note when it comes to diet is not one diet is perfect for everyone. Not all foods are good for everyone. And trial and error can be something to look at. But honestly, a very well balanced diet of organic vegetables, a little bit of fruit. I think we have a lot of people who perceive healthy food as fruit, and fruit converts to sugar. So we want to be careful not to overdo fruit, non-starchy vegetables, good sources of organic or grass-fed or humanely raised animal protein and wild caught fish, and really focusing on like ancient, if you're going to have grains, like ancient grains, sourdough bread. Make your own if you're so inclined. That's not my gift, but I wish it were. Grow your own sprouts. Like, have a good balance of healthy food. So food, and then air and water. Clean air and water is absolutely essential. And we live in a very polluted globe right now. Here in America, all you have to do is look up on any given day and see, you know, trails in the sky, and who knows what's coming out of them. And it's coming down on our waters, it's coming down on our farmland, it's coming down on the animals we consume, it's coming down on the air that we breathe. So we can't ignore that. You can ignore it and live in ignorance, but honestly, we have to factor these things in, because we're sicker and sicker and sicker, and we have more medical, and we have more medications, and we have more therapies than ever before. So why are we sicker? So we have to start looking at the foundation. So food, our air and water, and then movement. And a lot of people think that they can out train a bad diet, or they can out supplement a bad habits. And the fact of the matter is, we need to move. But if you're training for something, support the body enough to support the training that you're doing. But for most people, we need to walk, lift weights. We do need to lift weights, especially women as we age. I'm, postmenopausal. And if we're not lifting weights going into it, we're going to suffer with muscle wasting as we're going through it and come out of menopause. So lifting weights, but doing it, you can lift 8-pound weights or 10-pound weights. You don't have to be a bodybuilder. And a lot of women, especially women who overtrain and their body's not really able to support that, have horrible hormonal issues through peri and menopause, postmenopause. So we want to make sure we're moving appropriately and doing some things that just make sense and are sustainable. If you can't do it when you're 80, don't do it when you're 40, unless you're training for something specific. You want something that you're going to be consistent with, because the body doesn't like stuff all over it doesn't like you doing one thing one week and then not doing anything for 3 months and then going hardcore again. It wants consistency, and it will reward you greatly.
I like the phrase that you used, and I want to try to elaborate on it. You said you can't out supplement a bad habit, just like you can't outwork a bad diet. When people are trying to think of, okay, how can I improve my health? Well, I know that I need to eat better, but maybe I can just take a pill for that. Why is that not the right way to go, even if I may see the same results as if I were to go to the gym?
So supplements are a multi-billion, maybe even $1 trillion industry. I have no idea. When I was a little girl, I remember going to the very small grocery store that probably could fit in my house and getting what we needed for the week. And it was, what I would say in today, probably the size of most of the bathrooms. I mean, it was so small, but we had everything we need, and we lived in the city. And the supplement area of the grocery store consisted of like 4 things, because we had Centrum. I remember we had Flintstone vitamins, and we had one a day. That was like it. And there was probably another one somewhere in there. Today, it's a full-blown grocery store aisle, two-sided, filled with everything under the sun. And New York Attorney General, they did kind of a crackdown. They went in and went into all the box stores, you name it, they went in there and they analyzed a ton of different supplements. And what they found is most of the stuff that they're saying is on the front of the label didn't match the back of the label, and all the good stuff that we were looking for wasn't even in the actual supplement capsule. So we have a lot of, I'll say, fraud out there. And what's sickening is this is people's hard-earned money that they are spending on these things to try to get well. And so when we look at supplements, We definitely want to make sure we are getting the things that we absolutely need. Don't just go buy a one a day all inclusive vitamin because you need certain things at certain times of the day. There's a term, it's actually called chronobiology, and it is the best time of day to take something to support the needs of the body. Like the liver likes to rejuvenate while we sleep. Gallbladder starts up around 11 p.m., then midnight to 3, the liver's kind of kicking in. And so if we're taking things to support the liver, like vitamin D at 8 o'clock in the morning, which most people like to take their vitamin D in the morning, shocker, you're going to have poor absorption and it's not going to be nearly accessible to the liver at midnight if you take it at 8 a.m. So we know that taking vitamin D, which this might be a news alert for a lot of people, but taking it at dinner, it's a fat soluble vitamin. So taking it at dinner with your food is the best time. You could take 10,000 international units at 8 a.m., or you could take 2,000 at 4, 5, 6 p.m., and your absorption rate will be better. And if you did that for a month and went and got lab work, I guarantee you, because I've seen it, vitamin D levels will be higher. So taking supplements needs to be like, it can help you get yourself back on track and feeling well, but you still can't just supplement and continue to eat processed foods and not do the things that we need to do, just not working out at all and expecting the body to find what it needs, because it'll rob your body will rob Peter to pay Paul 24/7 until it can't get what it needs anymore. And when it can't get what it needs, that's when we get symptoms. And you can easily spell symptoms with the S's with dollar signs, because that's what happens if we don't get to the kind of the source of what's going on. If you are consistently eating a 80-20 rule, or eating an 80% very healthy diet with your, maybe a dinner here or a vacation there, when we have a very consistent diet, we can actually stay on top of things where just basic supplementation help.
I was thinking this entire time that it is very true. The US government, or big pharma, whatever you want to call it, profits very heavily off of illnesses and disease and treating those diseases. You also mentioned the first time that we ever talked that people shouldn't have to go broke to get well. And I like that because it is a very powerful statement that you don't realize is true until you actually think about it. But how do you combat this in terms of your own practice? Because the things that you're talking about, if I'm just listening to it and I don't know anything about you, I would think, well, doing my blood work, doing all these labs, doing, all this kind of internal work, it's going to cost me thousands upon thousands upon thousands. And I just don't have that. And there
Right.
is this fear that people have, which is why they maybe don't go to the hospital or why they don't go to the doctors. Like I had a rule growing up. It was unless you're projectile vomiting or bleeding, you don't go, which is not a great not a great thing to say, but that's a state of fear that a lot of people are in because they're worried, like, I don't want to have to shell out $5,000-6,000 just to be told that I need to take another pill and have to pay more money.
Absolutely. And I will say the natural medicine world is not always, they're just like the medical field, it can get very expensive. So you want to really seek out somebody that you trust and that you really have confidence that can help you try to get to the solution fast. And blood work, depending where you are in the country, but where I'm at, we can usually get most of the blood work we need. I mean, I would say 95% of everything that I would need to put together a protocol, we can get it for under $400. And then there's a fee, of course, to putting everything together, and then a supplement plan. So here's the thing, the longer you wait to take care of something, the more expensive it's going to be. Now, that doesn't mean you get a sniffle or you have a tummy ache or you have a bout of diarrhea that you have to run and go get all this done. But if you are, 2 or 3 months in and you're not getting better, the first thing to do is start with labs, because labs don't lie. It's what's going on in your body right now. And labs are a moment in time. The one true, like, 3-month term is going to be like a A1C. That's going to give us a 3-month idea of what your blood sugar is over a 3-month period. But all the other labs that are ran are right here, right now, the moment that you got the labs done. So it tells us like, what do we need to go after right now? And what are some things that are either looking like they could be a problem or they could be coming down. So you might do another bout of labs. And a lot of times insurance companies will pay for labs. So that is, a great thing for the patient that they don't have to pay out of pocket. I have out of pocket pay, but I also tell them what to order from their doctor and they can do it that way and just check and make sure your insurance can cover it. Because if it's not coded right and your insurance doesn't pay for it, that it could come back a little bit pricey. So you have to take a little time and make sure that with your doctor or with the administrative staff at the clinic that you're working with, that insurance would take care of it. A lot of the holistic practitioners don't take insurance or private pay. It's only because, it's insurance and insurance hasn't even licensed, which we're in the process in our state of getting licensed as naturopaths. Insurance is still probably going to be a little questionable. But as far as expensive and not going to the doctor, and we have to put a price on our health. I mean, I know people who, say, "Oh, I just can't afford to go to the doctor." I don't know how you can't afford not to. If you've been sick for a while or you haven't felt good for a while, things are not going to naturally improve if you're not changing things. So the one thing people can do all on their own is really take a hard look at their diet. If they're strictly vegetarian, maybe they're low in iron and they need to incorporate, some beef or take an iron supplement. Maybe they're keto and their gut is a wrench. Well, maybe they're not eating, they're eating a lot of processed meats and dairy. So, I mean, we have to look at diet first because sometimes that can help. And it takes a little bit. It takes 2 to 4 weeks. It may even take 2 months to try to get things back on track. But look at those foundational things. If those things aren't intact, it's like a revolving door, right? You're always going to, if you're found, it's like building a house. If your house isn't on a strong foundation, the likelihood of it cracking or having other problems down the road is inevitable. And the same thing with our health. We need to have the foundations laid in place. And then there's like castor oil packs, for instance. I don't even think we touched on that, but castor oil packs is an absolute game changer for some people who have stomach issues, who have pain issues. So there's all types of homeopathic home type remedies that actually do work. I talk about them on my blog that I have on my website. I go into some of the homeopathic stuff that I like to talk to with my patients. So that's open for everybody.
Nice. And I'll definitely make sure to put a link to it so people can find it. But
Perfect.
shifting gears a little bit, when we spoke last, you said that you didn't like the idea of weight loss to wellness in terms of if I lose weight, then I'll feel better and my mentality will change and I'll just be a completely new person. But it's wellness to weight loss. And I think this is a concept that not a lot of people actually take into consideration when they think of weight loss. They just think of, I feel sad, so I need to lose weight and then I'll be happy. But you're saying that you need to be happy and then you can lose weight.
Yeah, I've struggled with my weight most of my life. And I would say finally at about age 49, I started getting it dialed in and then menopause hit. And then it was a whole nother phase. So I had to kind of relearn some things and I had to do things differently. And so I can help people on, the front side and through and on the back side. So weight loss, I would consider myself a specialist in it. And our slogan is you don't lose weight to get well. You want to get well first. And getting well isn't just about food and exercise. It's about our mindset. It's about the stresses in our life. And if you didn't know this, stress is the number one killer. And there's good stress and there's bad stress. The body doesn't necessarily know the difference in stress, so we want to analyze the stress that we're in. Is it a relational stress? Is it a work stress? Is it our children, our health, or what are we just do we have a lot of anxiety and we don't even know why? Do we feel depressed and we have a great life? There's all types of stress. And it's journaling can be a big help with trying to decipher really what is the stress. So a lot of times when we go grab something quick, it's because we're feeling something. And I coach my our patients to just journal. I know it's not everybody's thing to journal, but have even a notebook in your purse or have a notepad by your bedside. And when you are like going to the vending machine or you find yourself making a quick turn into a gas station or for no reason at all, you go into the kitchen, into the pantry, and you grab a bag of chips. Like what you have to start recognizing what is triggering that. Is it, are you thinking about something? Are you bored? Are you sad? Is there a relationship that's gone south that maybe you want to work on repairing or going to therapy with or finding solutions so it's not such a stress? And when we have stress, I will tell you won't sleep well. And if you won't sleep well, you're not going to eat well. Your brain's not going to function. So stress has to be dealt with. Our mindset has to be worked with too, because, I'll say to people, today's problem can go away just like that tomorrow. And so it's a temporary issue, but we don't want to make it so that it's debilitating just how we process and proceed through life. And so we can't just look at wellness as the food we eat and the water we drink and the exercise we do. We want to a full picture and our mindset has to play into that. Our stress has to play into that. And those things when we have a lot of stress, it also creates inflammation in the body too. So now we have a combination of stress and inflammation. And if we can start reducing stress, we can start reducing inflammation. They all go hand in hand together. So I would highly recommend people really take a look at what is causing them to not be happy or not be excited to get up in the morning and get through their day. Because to be well, it's those factors I talked about before, but then the mindset component. And from there, we can focus on the weight loss part because otherwise the weight loss will be temporary. The weight loss will be maybe not as good as it could be. And you'll work really hard to get results. And then you'll go back to your old ways. And one of the other things I coach our patients on with weight loss is you have to have a big why. Like, what is the why that makes you cry? Like, if you don't lose this weight, what is attached to that? Is it that you won't be able to get on the floor and play with your grandkids, or all your friends are going to be playing sports and hiking and traveling and you're going to be stuck home debilitated? I don't know what it is for you, and it's very special and unique to everybody, but it has to be the why that makes you cry. So if you don't lose this weight, where will you be 5, 10, 15, 20, 30 years from now? What will your life be like if you're not making the right changes? So you have to work on the wellness component first and then move into the weight loss, and they can be done at the same time, but wellness has to be at the forefront.
Definitely. I was thinking about that when you were talking about the importance of, taking care of your mindset. And so many people preach this. They say, like, you need to take care of it. And then you have some people that say, yes, you're right, I need to change. And you have other people that say, no, you're just saying that so you can sell me a dream. What are some misconceptions when it comes to your practice, like taking care of your wellness, like taking care of your mentality, that people are just not actually focusing on that they should be? Because stress is definitely one of them, and then inflammation, it carries alongside with it. And I think people are kind of waking up to the importance of not being under chronic stress, but I don't know if inflammation is spoken about as often as it should. And what are some other of those factors that you've noticed just as you've had these patients and as you've been developing in your craft?
So that's a loaded question. So I'm going to start with I know here in the US, I can speak because I'm here, and it's maybe prevalent across the globe, is we are a quick fix nation. Like, we want it fast. We just give me a pill so I can go on with my day, go on with my life, and get back on track. And as I mentioned before, take that pill, take that name, and do a Google search for side effects. And better yet, talk to your pharmacist, because your doctors are very limited in what they know. They have very limited knowledge to the drugs they're prescribing. If you have X, you get this. If you have Y, you get that. But talk to the pharmacist, like ask them questions. Don't just have them rattle off whatever. Say, no, now what are the known side effects? And open up that page that comes with it and do your own due diligence. So taking a step back, and when it comes to a perception of naturopathic medicine, I've been doing this for 12 years, and I will say maybe it's since, 2020 that people are becoming more astute to naturopathic medicine or natural healing or natural therapies and more involved with more supplements. Hard to believe because we were already like a multi-billion dollar industry in the supplement industry, but to think that it's probably doubled since 2020. We do have to just understand that not everybody grew up understanding that there's any other kind of doctor other than your medical doctor. Because even my generation, late 50s, 60s, and 70s, whatever your doctor said was golden. Doctors had a little bit more flexibility back in the day, so to speak, where today they are, and I can speak to this because I've had medical providers tell me this, they are governed and they are told, if they don't prescribe you something and you have the symptoms for it, they have to answer for it. So doctors are doing the best that they can within their boundaries. And naturopathic doctors or healers or herbalists and acupuncturists and chiropractors and more alternative care, we take a step back. We're looking at the body as a whole. We're not just looking at one specific thing. You have this symptom, we're going to give you this med. Well, this med may create all these other symptoms, but now you need this drug, kind of like what I talked about before. And so what we want to do is we want to find out what is the core. And when people understand that going to a holistic practitioner, you may not have instant change in your symptoms, but over the course of 5 days or 2 weeks or 3 months, all of a sudden you've got your life back. Where in the other platform, they're giving you medications and all of a sudden you feel good right away. But as time goes on, you start to feel worse again or other symptoms come up. So it's really an individual preference. I don't try to convince anybody that natural health is for them. Most of, practitioners that work in my realm of practicing, they're getting referrals and, they've built a reputation based on results. And I mean, I have people who they are married to someone who won't eat anything green. Like they won't eat any vegetables, they won't take supplements, and they think all of this is quackery. And all I can say is, well, if that's what they believe, then that's good for them. We can't convince people to do something that they don't feel is right. It's like somebody who believes, if just a kind of a drastic, but if somebody believes chemotherapy will save them from cancer and they did not do chemotherapy, that could actually kill them too. So, because their mindset is there. So we have to honor where people are at, and people who don't believe in what I do don't come to me or their spouses just do their own thing, and sooner or later they kind of, it's funny, they do join on. They at least start eating better. They might even take a supplement or two, but it's not for everybody, and that's okay.
There was a guest that I was speaking with that said you can't help those who don't want to be helped. So it's kind of just to each their own. You do as you do, and I respect your choices
You do.
regardless. But I hate to cut this off, but we are at our time. 40 minutes went by extremely quickly, and I think I could talk to you about this for another hour and a half.
Oh, I know. There's so much. There's so much.
Well, thank you so much for your time today, Angela. Is there anything that you would want to leave our guests with in terms of your last bit of knowledge, advice, anything that you have for them, or that they can have to look forward to you if they are actually curious about taking this next step in their wellness journey?
Well, I do have, it's a free assessment where people can at least take an assessment to see what vitamins maybe would be good for them. What's great about this assessment is they can just go to the site, take it, and take the information. There's actually documented third-party double-blind study that they can cross-reference to see, they can bring up those studies to see why they might need vitamin D or why they might need a B complex type vitamin. And it'll compare it to what their symptoms or diagnosis or family history or lifestyle is like, and is absolutely free. If it's something that they're interested in ordering, they can absolutely reach out to me. So I can provide you that link for that. But it's
We'll
just
definitely link it in the description below so they can get
yeah,
access to it immediately.
I'll link that. And then if anyone is interested in reaching out to me, people who are coming through the IWA, they can get $100 off a full lab review and findings. So they can get their labs done through their doctor, and I'll take $100 off the review.
Amazing. Well, thank you very much for your time today, and thank you for giving us all this wonderful information about how we can actually take the next steps forward in our health and not go broke while doing it.
Well, thank you for having me. It was an honor.
And that wraps up today's episode of Vibrant Living Diaries. It has been an absolute pleasure having you with us. A huge thank you to our guest for sharing your expertise and to the International Wellness Alliance for making this possible. Remember, the insights and stories we've shared today are steps towards embracing a life of holistic fulfillment. We hope you've been inspired to take the next step forward in your own wellness journey. As always, we're eager to hear your thoughts and experiences. Connect with us on our social media platforms and feel free to share how you're integrating the knowledge gained here into your daily life. Your journey is important to us, and we look forward to growing together. I'm Danielle Grobman, and can't wait to continue this journey with you in our next episode. Until then, keep exploring, stay curious, and embrace the vibrant life you deserve. Speak soon.